Hi everyone, this is Taichi Hatta from the Shizuoka Graduate University of Public Health, founded this April. Before starting my talk, I would first like to acknowledge Dr. Felters for chairing this session. Today's talk is about the methodological part of our research article published in JSMMR last year. And we received a lot of helpful suggestions from the editors and reviewers in the process. I'm delighted to have this opportunity to speak at Asian Regional Conference. Now I will address the title presented here, Employing Rhetorical-Analytical Framework in Mixed Method Study, the Worldview of Ki-Shyo-Ten-Ketsu in East Asia. And the interest of my talk is how do we leverage culture in mixed method research? To think about this question, let me first overview the basic idea of MMR and how our cultural perspective differ from east to west. Mixed method is generally referred to as research methods or methodologies that integrate quality and quantity. But in practical terms, there are many definitions. Johnson et al. 2007 conducted interviews with experts in mixed methods to find definitions of mixed methods and also identified 19 definitions. They argue that the differences between these definitions result from these 5 themes. What is mixed? Mixing stage, breadth, why, orientations. They have methodological types or spectrums. By counting up these combinations, you might think we could show many definitions now for mixed methods research. However, I believe you will agree that it is not type of combination that are important, but how we integrate them is more important. As the editorial of JSMMR indicate, there are various dimensions of integration in mixed method studies. The dimensions presented here indicate most of the components of empirical research, such as research context, purpose, methods, procedures, limitations, and significance, including discussion. At a glance, mixed method has integration may seem complex, but these are also the things we need to consider when collecting and analyzing data. In mixed method study, it is very important to refer to the dimensions of integration presented here when discussing the methodological characteristic of the study. On the other hand, particularly for scholars who have not experienced the North American paradigm wars between qual and quon, or for non-English speaking students, it may not be easy to understand the methodologies so meticulously broken down. Next, I will mention our recognition style. This slide shows culture as a degree of tendency when you perceive phenomena. What do you see, or where to focus? If you see a picture or phenomena, some may focus on the individual to analyze their role and function. The others notice the relation between them from a holistic viewpoint. How do you think you feel contradiction? As Nisbet has mentioned, Westerners would prefer obliterating contradiction, and Easterners would accept it. I think this difference seems to be ultimate platform between analytic thinking and holistic thinking. When we discuss methodology or worldview, how do you discuss or convey your intention? Westerners seem to emphasize logic-based manner rather than an experience-based manner, although Easterners show an opposite trend. Here is analytical thinking. European thought rests on assumption that the behavior of objects, physical, animal, and human, can be understood in terms of straightforward rules. Westerners have a strong interest in categorization, which helps them to know what rules to apply to the object in question. The formal logic plays a role in problem solving. East Asians, in contrast, attend to objects in their broad context. The world seems more complex to Asians than to Westerners, and understanding events always requires consideration of host factors that operate in relation to one another in no simple deterministic way. Formal logic plays little role in problem solving. These slides show the other aspect of cultural differences between the West and East. In English-speaking countries, in primary education, it may be common to learn basic essay structures like introduction, body, conclusions. On the other hand, in Japanese early education, students are taught the Ki-Shyo-Ten-Ketsu as a structure of a narrative. It is an essential and familiar rhetorical style in Japanese, but rare or non-existent in English. Ki-Shyo-Ten-Ketsu, which originated in classical Chinese poetry, is an expository prose style that both Japanese and Korean borrowed from the Chinese. This is an example of classical Chinese poetry. This is the title, and this is the author name. There are 4 stages, 1, 2, 3, 4, and each stage must consist of 5 characteristics. The Ki-Shyo-Ten-Ketsu style composes introduction, development, turn, and conclusions. This slide shows the meaning of each stage. The first part, Ki, corresponds to the introduction in English, although Shyo and Ten correspond to body. Ten may not be familiar in English structure. Ten means at the point where this development is finished. Turn is the idea to the subtheme where there is a connection, but not directly connected association to the major theme. And Ketsu indicate conclusion, but it is not a clear description like an English conclusion, and vague descriptions are allowed. So, the author does not necessarily convey his or her intention through precise description, but a narrative structure shared with the audience. Having shared that narrative structure and the way we see things are different in the West and East, I will pose this question again. How do we leverage culture in mixed method research? First, the following definition of culture will be used in my presentation. There is little overall consensus on its precise meaning, although there is general agreement that culture is not objectified, self-enclosed, coherent things or object, and culture is not something that is learned by observing and documenting, but something that is inferred. Culture is portrayed, written, or inscribed in the act of representation of the inquirer. The term representation used here implies empirical materials obtained from core research and mixed method research. So, I choose it from various definitions of culture. In the following slide, I will show how we tackled this question in our research. Let's move on to our research project. In 2008, we launched the mixed method study project named MMIRA. At that time, the advancement in medicine, the Japanese government began promoting transition to outpatient chemotherapy and sought to improve the informed consent process. Some researchers have conducted studies examining physicians' skills such as sharing bad news about cancer treatment in Japan. However, little is known about the relationship between patient proactive interest and physician-patient interactions during IC consultation. The empirical object of our observational study were to describe the process and compare patients' motivations. We used core approach to investigate the interaction between physician and patient, and core data to evaluate the patient motivation for medical treatment. We encountered many methodological challenges while conducting research to meet this objective. One of the challenges was how to describe the case. In other words, we need to develop and compare the process of informed consent dialogue. This slide shows our data source and data in each case. We collected both quantitative and qualitative data by observing the process from the patient arrival to the short interview immediately after the IC consultation. In this study, as an observer, I participated in 10 IC cases of breast cancer patients and 10 IC cases of lung cancer patients. I made transcription from the audio record within a few days for all of 20 cases. Each case averaged about 60 minutes of dialogue, and the verbatim record was about 40 pages in A4 size. We accumulated 20 cases and developed the analytical strategy through the observation. The analytical processes consist of 4 stages, as shown below. In the first phase of the analysis, to support case-oriented analysis and ensure the dependability of participant observation, I briefed the second author on the IC consultations after each of the 20 cases under observation. The second author, Dr. Keiichi, is a clinical psychologist, and he was engaged in the palliative care unit in the hospital at that time. Through peer debriefing, we divided the contents of consultation into 2 categories: styles dialogue and impromptu dialogue. Styles dialogue, wherein oncologist informed the patient of task-forced elements of medical treatment. Impromptu dialogues, wherein oncologist responded to the personal interest of the patient. After completing observation of all 20 patients, we calculated descriptive statistics for the demographic variables to describe patient characteristics. Once the transcripts had been prepared for all 20 patients, we selected 2 patients with the highest and lowest motivation scores from each cancer group. 8 cases were selected in all. That is, we used quantitative data to select the cases for qual analysis. In the third phase, Dr. Narita and I separately read and analyzed the 8 cases transcripts in depth, following the chronological course of events, and selected 10 or 11 passages for each case. We read these passages jointly with the aim of understanding of speaker's attitude. We then discussed which passages were relevant in terms of showing the temporal changes in each dialogue. We selected 4 of the original 10 passages that demonstrate features the 10 passages in each dialogue. We also applied several rhetorical-analytical frameworks with 4 passages. We moved continuously back and forth between inductive thinking and deductive thinking. Then we identified specific topic sentence from each passage, organized the passage into Ki-Shyo-Ten-Ketsu style. In the fourth phase, to illustrate the integrated interpretation of how the consultations differed between patients with high and low motivation, the quantitative scores and the qualitative framework were merged using joint display. We designated each stage in each case in Ki-Shyo-Ten-Ketsu style. This allowed the creation of joint display, and the authors drew meta-inferences on the function of turn stage from the observation data. This slide and the next slide show a joint display. The vertical axis shows the case number, the motivation scores of each patient, and type of cancer, while the horizontal axis shows the temporal changes in the dialogue for each case. By showing quantitative data and qualitative results simultaneously, it becomes possible to read the process of dialogue. Furthermore, as a meta-inference, we are able to identify a functional turn. This is a joint display of a patient with low motivation scores. For example, in case of the patient with lung cancer in number 12, from the moment the patient arrived at the hospital lounge, I approached him with the impression that he would not respond well to the study because he looked strong-faced and difficult guy. During the introduction dialogue, the patient seems uncomfortable, coughed to interrupt the conversation, and kept his name card inside out so that anyone could not see his name. At development, I was also impressed by how physicians carefully and patiently explained the side effect of the chemotherapy. When the patient said that he felt pain due to the bad location of the needle puncture of the chemotherapy during his hospitalization, The physician explained that the pain could be caused by the side effect of the chemotherapy. As always, these physicians talked to his patient about median survival time, life expectancy, and palliative treatment. And as usual, there is a certain tension there. In this case, the turn occurred in the midst of the tension. From the moment the patient said anyway, to the moment the patient talked about his real concern in conclusion. The interaction was far from the defensive behavior that I was seeing in the past. We focused on the turn stage because this stage represented a turning point for the consultation in several cases. That is, sudden change of quality that plays a part of foreigner prerequisite to show structural changes in psychometric treatment. Ki-Shyo-Ten-Ketsu style allows for the description of turn and triggers to drawing meta-inferences as follows. First, an opportunity for the patient to become open about his or her real interest. Second, patient coming to terms with his or her cancer. And third, the atmosphere can become tense, but there was no turn. I would like to talk about my lessons learned from the study, and then indicate a future perspective. I would like to show a preliminary definition of rhetorical-analytical framework here. A structure for describing a series of chronological order events for sharing changes in phenomena. And it is language and culture dependent. As I have discussed here today, MMIRA has aided the analytical approach by using narrative structure that is unfamiliar to the English language. Since there are other narrative structures as well, I acknowledge that we need to accumulate further studies and inquiries into definitions and methodological concepts. This slide shows the lesson from the mixed method study of our experience. The inspiration to use Ki-Shyo-Ten-Ketsu style as an analytical framework came after the start of the observation. It is possible that in the course of mixed method study, the analytical strategy and MMR design may change, and the style of integration or rationale for MMR may be reconsidered. As mentioned in the editorial of JSMMR, it is worth noting the following discussion on rationality. Differences in the typology stem from the fact that Breiman based his typology on the relations rationales applied by the researchers after their studies were completed, versus at the time of design. Perspectives at that time of design, when researchers articulate non-intent, and after the data are collected post hoc, can look very different. We leveraged the Ki-Shyo-Ten-Ketsu style in convergent design. I think that the core design is more simple and therefore very applicable. In core designs, where there is a strong connection between design, integration, and rationality, we may inadvertently be led toward post hoc rationality. To maximize potential of core designs and to avoid fallacy, In future mixed method study that leverage culture, it will be necessary to make distinction between its rationality and its value. Okay, this is the final slide of my presentation. I would like to mention 3 points here. Mixed method research is premised on the tolerance of diversity. Second, by leveraging the rhetorical-analytical framework, we depicted a term that is unfamiliar in English and draw meta-inferences. Third, if you find yourself noticing cultural features in your iterative reconstruction of the MMR design, have the courage to write about them. I would like to conclude my talk. Thank you for your listening.